And let's not make it digital, but whatever that might be, because that is shifting all the time.
And so, what I just realized, talking about digital, Anil, is that technology was doing something a little wrong with our life today. Technology wasn't working. I just got a notification from my admin that all this beautiful conversation we had just now, some of it didn't get recorded. So we may actually have to do, I hope some of it not again, but I may have to ask you some questions again because LinkedIn wasn't getting it, Facebook wasn't getting it. I'm not sure what digital problems you were having with the platform this afternoon. So I hope you have a little more time with me. And unfortunately, I didn't even record on my phone. So again, for folks who missed our conversation, I've been talking to Dr. Anil, and I will drop his bio in the chat. Apologies for the what we've been having a technical difficulty, which I didn't know until I was just notified that technically we were not getting some feeds on YouTube and LinkedIn, and we just missed a whole bunch of conversation. But apologies to you, Dr. Anil, and we're going to do some of this again. Dr. Anil is the CEO and founder of eMHIC, and he was telling us a lot about eMHIC, the challenges that one faces. He talks about collaboration, the importance of collaboration, the impact on our resources, and in the eMHIC conference, the nuances of it. And he used a term like commissioner of care, that we have to look to all of us as commissioners of care, and the scalability of mental health. And it's a symphony. And so I'm going to go back. Bear with me, Dr. Neil, as we talk about why are you so passionate about being in this space of mental health and digital mental health?
The reason I'm passionate is because I've never been a person who's transactional. I have to believe in a cause or the people. And so once you do the right thing for the right reasons, I say rising tide lifts all the ships, whether it's a small or the big ships. So we have to do something. We have to believe in a cause. There needs to be a purpose for all of us, something we do. And the way we've been brought into this world, the way we look at the world, we look at it as our own nations where we live. Digital has no geopolitical boundaries.
Mm.
A mother losing a child in Canada or in Australia or New Zealand, it's the same grief that envelopes a person. So for me, I have this very innate philosophy which I passionately believe in, is one world, one family, one future.
Wow, I love that. One world, one family, one future. Go ahead. I'm leaning in.
Yes. So for me, so how do we create the sense of urgency? How do we get things, happening now? Because I think for far too long, we become totally accustomed to this long wait lists, which we hear about all the time. So how do we provide that support, that nudge, the care, support, and treatment? Not everyone is looking for treatment. Somebody could be looking just for information. For third
Yes.
party, you are having a challenge for your son having some challenges at school or something. So what you're looking for, a third party information. So all you need to be equipped with the information and in a timely manner. So I
Right.
think what we need to do is find ways and means to make it mental health more accessible. Another thing which is at this year's Congress, another big topic which is being discussed at this year's Congress, where the theme of this year's Congress is global mental health equity.
Mm.
Global mental health equity, digital solutions for an interconnected world. So far, we've got 23 countries already enrolled. 23 countries already.
Wow.
So we are hoping that there will be close to 49 countries by the time the Congress comes. And we will also have the presence of the UNICEF, United Nations, and also the World Health Organization. So it is the world's biggest event in digital mental health. I think because it's inevitable. It's just like a friend of mine uses this metaphor, which I quite like. He talks about this digital or AI is quite comparable to a tsunami coming our way. This massive tsunami coming our way,
Right.
and none of us are worried, and not we haven't started building our own surfboard as yet, to how to ride it out safely. But rather than becoming overwhelmed and consumed by it, we need to proactively get it right by design.
You know, earlier when we're talking and we were prepping for the show, you were talking about, that there's a wait list. And when you came into this space and you left your practice, practicing as a psychiatrist, you saw the need. And what was surprising to me when I heard that, you're not in North America, you're in New Zealand. So as you talk to people globally, is this a current theme that people are waiting, having long wait times to deal with their mental health and wait lists, opposed to other types of illnesses?
Um, Health systems, regardless of which country people are in, are overstretched. Um, so, in many ways, something is being done in some other areas of medicine, and mental health is challenged by other challenges like equity in funding. So the lack of resources in the mental health field can be a big challenge. So yes, the the need versus the available resources is a big challenge for every country in the world. That is for sure. So we see whether recently we were in Sri Lanka.
Right.
It was just absolutely outstanding to see the commitment from none other than the Prime Minister herself directly, and then commissioning the development of digital mental health roadmap for Sri Lanka. So our work at eMHIC has always taken a perspective top down. How do we get it right for the entire population as opposed to a small population base within the nation? So it's a hard work to do it as a charity, but I think but if not us, then who? So we have to keep going.
And why do you think you see this challenge with people addressing mental health? Like, it's been around, I mean, your mind is your body, and your brain is your mind, and it's part of who you are. But this disconnect between this part of our body and the rest of our body, why do you think, and being a psychiatrist, having done this work for so long, and even now as an adjunct professor, what is this disconnect and the lack of urgency you're seeing globally for governments and leaders to really make a shift in addressing how individuals are taken care of?
I think it's we are social beings.
Mm,
At the core of who we are the social beings, and the more and more disconnect that is happening with who we really are, for a variety of reasons. That means some of the things are being exacerbated in the way they manifest themselves, and how we end up seeing a problem, and being coming to us in different shape and forms, and where people are seeking help, and people are using AI or chat GPT as a personal therapist or a companion, or the range of solutions and the challenges we hear of all the time through the media. So rather than letting people navigate through these so-called self uh, discovery of what works for them, I think we also know that a very small proportion, only 1/5 of the total solutions that exist out there, are safe and effective. So we have owners, we have a responsibility that what is available out there is safe and effective, and that's not going to be easy task for any country or any sort of an entity to get it right. But doing nothing is not an option. So
yeah.
we need to make the beginning. We have to do something, and that alone is significant step in the right direction.
So what would you say, as you think globally and in the work that you do, are some of the biggest risks in mental health not being addressed the way that it should be right now?
I think we sometimes some aspects of mental health, and I think psychiatry is very much needed. So is primary care interventions. They're very well needed. Some of the promotion prevention aspects that are needed. But the thing is, finding that balance between what is needed across the care continuum, but also for the people like, I was talking to a psychiatrist in Netherlands who was telling me the wait list for the first appointment there is 18 months. Now, somebody has to wait in the queue for 18 months. Now, this is in 2025 we are talking about. All right, so somebody, and but it's no different in any, no better in other countries either. So I'm just using one country's example here,
Yep.
but does not
Same here in
mean they're
Canada.
better off
Yes.
in New Zealand or better off in Australia or in Canada for that matter. So the problem statement is quite challenging. When I also look at the completed suicide rates in Netherlands, for example, in 2023, the completed suicide rates. But when you look at the people of the completed suicide, how many of those presented are known to the Dutch Health Ministry of Health or healthcare system are only 40% of those. So what we're talking about here is, so what happens to the 60%? Because 60% of the people never establish, reach out, or come in contact with the traditional mental health support system. So that means, so even if you're going to improvise, whatever you're going to improvise, you're going to improvise it only for the 40%. So my at eMHIC, our aim and objective is to look at how do we create a system that is also meeting the needs of the people who, which is a total comprehensive population mental health strategy for the, even if that is inclusive of the 60% as well. So if I've got a financial distress in my life because I borrowed some large sum of money for
Yeah.
my farm where I need to buy some new stock, and but there are 2 years in a row big drought in the country I live in, and my inability to repay the loan back to the bank, I do not see that anything to do with mental health. So we all have different language, we have different notions of how we describe things, but the reality, a farmer out there, inability to repay loans, they do not see that as mental health at that point in time. So what we are saying is, we need to look at the problem statement. We need to have a comprehensive population mental health strategies. So where we can design and deploy solutions that work for all, not only for the 40%.
You said so much there. And I'm almost like, as I'm hearing you, I'm hearing topics for the conference, because when you talk about the suicide, completed suicides, that to me is huge. And imagine if we sat down and looked at that globally, what that really means. And then the measurement from those who actually had contact to those with the non contact. If we looked at this on a bigger scale, I don't think people understand when we say that we are in a mental health crisis, but the numbers are not coming together. And we have to find a way, Dr. Anil, to bring those numbers together. And, um, as I hear you and you see the gaps, do you see digital mental health as filling some of those gaps that are currently there to addressing people's need for help?
I think every little bit matters. So there are most of the traditional mental health support systems and services that exist and are out there in our respective countries are excellent. So uh, we would never advocate for replacement, or digital is going to be the only solution. Digital is complementary part of the care continuum. It has a place, but it's never replaced the physical services. So how do we 1 + 1 = 11 kind of a model? So how does it all
Yeah.
work together? What does the collaboration looks like? And because so even if I come and see you today, for example,
Hmm.
uh, but and my next appointment is in say 3 weeks time or 4 weeks time with you. So what do I do with it when I have a need to connect with something, a challenge I'm having? The digital could be just the thing which you have prescribed me, for example, for that matter. And when I come back, I'm feeling a lot more supported and a lot more safer when I walk away, because otherwise the anxiety of this. I'm 4 weeks away to see you before I see you again.
And it's that bridge, it's that bridging care that is needed. I love that, because I have found such a deficit in the bridging of care, the bridging of, and even the understanding of even family carers who are trying to even understand what is happening, how they can support. So I can see how digitally and digitalization can really help this. And so you've left your practice, you came from the Himalayas to India, you went to New Zealand, started your family, you have three amazing sons, a beautiful wife, and you're like, I am frustrated as a physician, I'm just not seeing them getting the help, and you started this eMHIC conference. Now, how long has it been happening, the conference?
So this year it's going to be 10 years. So
Wow.
the Congress in itself is turning 10 years. So it's a big deal. It's a 10th birthday in Toronto. And to celebrate the 10th birthday, eMHIC is also launching a brand new initiative, the world's first digital mental health magazine,
Ooh.
which will be showcasing um, um, the international best practice in this domain in pure language, which most people, like commissioners of care and other people who are wanting to get inspired to see what works. And so this magazine is going to be called Interconnected. That's the name of the magazine, Interconnected. And the front page is graced by a lived experience leader, Tammy Allen. She is also the mental health commissioner for South Australia, and she'll be gracing the cover page because we put a lot of emphasis on lived experience.
Like, I'm saying to folks, if you have not been to this conference, it's a conference that you need to attend. And like, when you say who's on the front cover, I'm already stoked. Last year I had the opportunity to be there in Ottawa. I thank you for allowing me to be there as a carer, and to share that perspective. And I just want you to, if you can just add a little more as to why people should really attend this conference, because it's like no other conference. I haven't seen another conference like this before. And I know you attend many conferences. Why should we attend this conferences?
Yeah, I think this event, um, there are no egos in the room. Everyone wants this world to become a better place. Everyone wants everyone else in the room to do, uh, get to the success they deserve. So when there are no egos, when we joined by the shared purpose of getting it right, and I think, and because our focus is just on implementation, and then you also think we, regardless of which side of the border we sit on, there are 23 countries are already enrolled. You just think actually the problem statement is same, universal, regardless of which country we are in. We're just approaching it slightly differently. So if you want to be inspired what good looks like, if you got amazing thing you want to come and share, and become part of this movement, global movement, then you need to be there, because people work with people. And once we
Yes.
know you, you will become integral part of the solution. The world needs you, basically. So we want you there because I think we are in it all together.
And so the conference is happening when?
It is happening on Wednesday the 19th, Thursday the 20th, and Friday the 21st of November this year in Toronto at Westin Harbour Castle Hotel. And 20th, which is the Thursday night, there is a Leadership Excellence Award dinner as well, which is a very special evening because we celebrate a leader from each country, only one person for each country. And I think that is very important to mental health is hard work. It does not mean we cannot celebrate what good leadership looks like. And so it'll be just amazing for you to be there, not only at the Congress, various events, which is inspiring, but also to see what good looks like. This is kind of hundreds of Albert Einsteins walking around in the room. How exciting is that? Gives
Yes.
me goosebumps.
It truly is. And when you said there were no egos in the room, I know I was nervous being there last year, and I felt so at home. And what was beautiful was there was just this commonality, and people really wanted to help. People wanted to have solutions, and the information that was shared globally, and realizing that we're not alone. Like sometimes you're in your silos in your own country saying, oh, this is just Canada, this is just here. No, everybody's experiencing a challenge, and when we come together, how we can solve that challenge and be better. And so, I mean, what would you say, as we start winding down? And I just love talking to you. I can talk to you all day. And I'll tell you, if you're not tuned in, go to the website. I'll put the links in the chat. The conference is the 19th to the 21st. But tell me, what's that mission for you, and who should be really at this conference?
The mission is very simple as to how do we create timely access and systems navigation. Uh, let's unpack the complexity and make it so simple. So when I need something, but it's easy for clinicians to talk about mental health speak and over pathologize things. The reality is, all I need is some help at that point in time. So how do I get to the right place in the right manner, whatever that means, contextually right and relevant for me? Because there are major complexities. Not, there's equity issues, whether I live in Nunavut and up north and far north in Canada, where the no two cities are connected by road. And so over there, digital is not a luxury, it's a necessity. So, so
Mm.
what is the role of some of these things? Some of the marginalized population in a variety of countries, we know they have poorer access. One of the programs we are working on with the United Nations is on humanitarian settings. So over the Deputy Secretary General of the United Nations, Amina J. Mohammed, last week in United Nations meeting at UNGA, which is United Nations General Assembly in New York, was sharing around 300 million people around the world in humanitarian need. 300 million people.
Wow.
Now, majority of those people have access to no mental health support services at all. Majority of those people have no shelter security, no food security, but all of them have phones. So that's what I would say we need to look at how we provide some low intensity, whatever the support looks like. Something is better than nothing.
I just thought of something, as you said that. If you were to describe mental health to folks right now, and even breaking the barriers, breaking the stigma, what is our mental health, and how can we help break that stigma of actually dealing with it?
Yeah, so I think that's a big, uh, it's a question you have asked.
No.
I think most of the countries are trying to deal with it, addressing some huge, amazing investment. New Zealand Ministry of Health, Canada. There's, some many nations. I wouldn't name all of them, are doing excellent work in breaking down stigma, discrimination, and all that work. Fantastic work. But the scale of the problem is so huge. It almost feels like a drop in the ocean.
Right.
So whatever we're doing is so how do we prioritize, and the scale of funding is not sufficient, let's put it this way. And that's why at this year's UN General Assembly, all 160 countries have agreed to prioritize mental health, which is the first time in the UN history. So we are looking at that. I love the work of Professor David Clark from Oxford University, who talks about the economic argument, not a clinical argument. He says, cost of doing nothing. What is the cost to the nation? And so Lord Richard Layard's report, which pointed out the economic sort of challenges for the nation of not doing anything, that got some of the initiatives funded in improving access to psychological therapies. Now the program is called Talking Therapies now. Now the program was not funded on economic or clinical argument. It was funded on economic argument. So look, doesn't matter how it gets funded, so long it's just being funded. So the problem is huge, and we still got a long way to go. And all the things around stigma, discrimination, other things, I think, but doesn't matter how small it is, but continuing to build on what we are doing is the key here. So we must carry on. We need to be not transactionally driven. We need to be doing it for the right reasons. We need to be creating a community of interest which has got same sense of urgency of getting it right. So it cannot be left to a particular strata, just the commissioners of care, or just the hospitals, or just the primary care. Or so I think we need to look at that we are all part of the solution. Sometimes you got no idea. Just the listening ear you gave me, probably that was the best thing that happened in my life, probably. And just being able to empathize with me, just the helpful advice. So I think be kind, be kind, and empathize with the person right next to you. You've got no idea what they might be going through.
I really love how you really speak to that. Listening is so important. Empathy is important. Creating timely access to care, and we all have to come together collaboratively. This is not a solution, a problem that we can solve, in silos. We must come together. We must have conversations. And you touched on, as folks listen to this, I remember, in speaking with you, you've talked about the economic impact. But as you said earlier, a farmer has to borrow money. And I think about, sometimes these collection agencies or these financial institutions, they put this pressure. Yes, they have to get their money back. I also think they have to learn how to train individuals to come after people, because if we were to really look at maybe even some of the completed suicides, a lot of people will be taking it for because they're feeling this, the financial strain, and everything ties into our mental health, how we deal emotionally, the impact. We also look at carers, family carers. They're in a mental health crisis, and we're not even dealing with their loved ones, and we're not dealing with the mental health of family carers and how are they navigating their loved ones. There was a time that people were, and I think it still is, language is so key, where they refer to people dealing with their mental health as crazy and all these derogatory terms, and not realizing our mind is our brain and our brain is our mind. And so I am so I'm just so happy to really have met you and see the work, because when I met you and I saw the work that eMHIC was doing, I got hope when I was feeling very hopeless. I saw not just one country, not just one community. I saw a global community, and community was a key word for me, coming together. I saw the conversations in silos. I saw the conversations in the room, and people really wanting to hear each other. And that we have to be kind in this world and show up for one another, and how can we help each other. And so, Dr. Anil, as we wind down, what is some of the messaging that, if you were to say to governments or to anybody listening on this line, what is a key message you want to get out there, as you're so passionate about what you do? You said there's how many countries are already attending the conference right now?
23 countries.
23 countries. We're looking for 40, and I'm sure we can get more than that. The Western Harbor Castle can fit a lot more. Last year you had over 60 speakers at the conference, all gleaning from each other. But what is that message you want to get out? If you had anything that you wanted to say, to just get it into to people out there that are listening.
I got just three things I would like to say as a closing comments, remarks. Number one, when I going back more than 2 decades ago, when my journey started in this full time, at that time it was a conversation which was just nestled within US, Canada, Sweden, England, Australia, New Zealand. Today, overwhelming amount of part of this component of this conversation is sitting in global south, India, Sri Lanka, Bangladesh, Africa, South America. It's quite amazing. So it's no more just a thing which we need to see it as it is only for the developed nations only. It is everyone's conversation now. Number two, I would like to say we need to get it right by design, because majority of the projects which are happening around the world, um, they're just project based. There is no baseline funding. There is no ongoing sustainability beyond those 2 years or 1 year, 3 year life cycle of funding. So I think we need to look at it very differently. Do we stop certain aspects of oncology treatments because we have just run out of budget or something? So there are certain things we take very seriously in some other aspects of the medicine. So we need to look at how do we create. So otherwise, I see some of those amazing digital mental initiatives have been stopped in some countries because they're graveyard of pilots, not because they were not good, because the funding ran out. So my thinking is how do we get it right by design for sustainable and scalability part of it. And the third thing is this is not about digital. This is about people and it's about trust.
Mm.
Come and become part of the family, become part of the global family at this Congress. This is, as you have said, Nicole, in a beautiful ways, this is unlike any other event. This is about becoming part of the value set where we're going to get it right. Because even in the time you and I have been talking, there are hundreds of people out there around the world wanting to access something which they do not have right now. They do not know how to get there or how to access it. So let's become part of the solution. Come along, and I would love to meet you all there. Come along and say hello. Thank
Yes,
you.
and you know what? You're very approachable. Right now, I just said hi to Isha. Isha is going to be one of the speakers. Isha is a young woman who is going to, share her story. And Isha has even written a book. She's done a movie with her mom, journaling her time through when she was having to access care. And Isha, I'm so happy to hear you, see you listening in. And Dr. Neil, as you talk about it, we have to talk about innovation, inclusion, being culturally sensitive and care. We have to recognize that no matter what people are experiencing, whether it's at work, at home, if they're dealing with a physical illness, as we call it still impacts their mental health. So if we keep disconnecting the two, it's like separating the head from the neck, and we're not functioning, and we're showing up looking good, and everybody says, "Oh, Anil, you look so great today," and but they don't know what you're dealing with. So in a world when we can show up, we ask you to show up and be kind. We ask you to show up at the conference. It is going to be at the Western Harbor Castle, and on the 19th to the 21st of November in Toronto. Be sure to go to the website, check it out, and listen. I am excited to be there. I thank you for even having me as a speaker and coming from the family perspective. But there's so many people. I've seen Canadians on board. I've seen Australians on board. People from all over the world speaking on various topics. This is a game changer, folks. And Dr. Anil, but you have done the investment, you and your team, Nikki and Kim, and those. It's a small team, but it's a powerful team, and the people that are coming on board to help you, the speakers. I look forward to seeing the magazine. I am excited. You are one of the supercalifragilistic espialidocious people in my life that I am so honored to know. And I pray that you are strengthened as you continue to do this global work, creating global impact. And together, as we all share this space and care for one another, that we can make, as you said, I'm thinking about some of the things that you said. My mind is racing, one drop at a time. But as you add a drop to a glass and another drop to a glass and another drop, so you have 1,000 people in a room, adding a drop into a glass, it becomes a whole glass of water, and somebody can have a drink. And that's almost the analogy I saw. And that's what creates rivers. That's what creates oceans and lakes. So, Dr. Anil, thank you for being here with me today on the Victory Speak Show. We are speaking victory in mental health and wellness. We are going to speak positively to ourselves. We are going to speak positively about mental health and wellness. And if you're not sure, there are resources that you can get, and you can always reach out to me. We'll put some resources online. Go to the eMHIC website. You know what? Here's what I'm going to do. I'm going to go on my phone right now, and it's eMHIC, eMHIC global.com. Go there. You will get some information. Hopefully you can come to the conference. And if not, you'll tune in, but look out for the magazine and their webinars. Dr. Anil and the team put on webinars that you can sign up for. And so there is no lack of resources. Together globally, we are going to create a paradigm shift for the better in mental health. Thank you, and see you next time on the Victory Speak Show. Dr. Anil and we're going to have some conversation because we just love talking to each other offline. Take care.
Thank you. Thank you, Nicole.